Welcome dear student. In one another session, myself Darshana Sandeep Shinde from Kekewak Institute of Pharmacy, Chandori, Nasik. Our today's topic is factors modifying drug action. Let's start our lecture. Learning outcomes of our today's session are: students should be able to understand and recognize various factors affecting on the drug action. These are the age, sex, then time of administration, route of administration, climate, genetic factor, emotional factor, presence of disease, metabolic disturbances, cumulation, additive effect, synergism, drug tolerance, antagonism, and drug dependence. Factor modifying drug action, in that first factor is body weight. It influences the concentration of the drug attained at the site of the action. The average adult dose refers to the individual of the medium build. For exceptionally obese and the lean individuals, for the children's dose may be calculated on the body weight basis. This can be calculated by the formula: individual dose is equal to body weight in kilogram upon 70 into adult dose. This kind of the formulas are used to calculate the body weight. The next factor is the age. In that, infants and children may not react in the same manner as that of the adult one. The dose of the drug for the children often calculated from the using various formulas. In that, child dose is equal to age upon age plus 12 into the adult dose. This is the Young's formula. And another one formula, child dose is equal to age upon 20 into adult dose. It is known as Dilling's formula. By using different kinds of formula, we can calculate the drug. Then third factor is the sex. Female have the smaller body size, so require dose of the drug on the lower side of the dose range. They should not have been given quinine during the pregnancy and sedative drug during the lactating period. Routes of drug administration, in that, route governs the speed of intensity of the drug response. IV route dose smaller than the oral one. A drug may have the entirely different uses through the different routes of administration. Example of its magnesium sulfate. If it is given orally, it acts as a purgative. If it is given parenterally, it acts as a sedative. If it is applied locally, it reduces the inflammation. The next factor is the time of administration. It has been observed that the endogenous body clock, that is the circadian cycle, may affect the response of the drug. Example of it that coronary heart diseases, short-acting calcium channel blocker seems to be the less effective than the beta blockers in reducing the ischemic events during the night and early morning. That's why time of administration is one of the important factor. In a climate, certain cases of climate also serves an important factor for the drug action. Example of its, alcohol is well tolerated in winter than in the summer season. The next factor is the genetic factor. Individuals are unable to metabolize certain drugs because of the certain enzymes required for their metabolism. The administration produce abnormal reaction in those individuals because of absence of the certain kind of enzymes, and these are absent in some individuals because of the lack of the specific gene coding in their genetic setup. Example of its, deficiency of glucose 6 phosphate. Some people are by birth they are deficiency to digest the enzyme glucose 6 phosphate. That's why they are unable to complete the carbohydrate metabolism. That is genetic factor, by it give by the birth. Then emotional factor, personality of the physician. Inert medication, that is placebo, may be prescribed to the psychologically ill patient who in fact do not suffer from the physiological disorder. It produces the psychological relief and have the beneficial effect. This is for the psychological dependent patient. The next factor is the presence of disease. Pre-existing disease is an individual also plays an important role in the determining the dosage as well as the effect of the action. Example of its, antibiotics like the streptomycin and kanamycin mainly excreted by the kidney, so they may be toxic or parenteral administration in the patient with the impaired kidney function. That's why presence of disease is a important one. Another one example is it has also been observed the drugs like the barbiturates and chlorpromazine produces the usually prolonged effects in the cirrhotic patients. The next factor is metabolic disturbances. Metabolic disturbances is one's body can drastically affect the drug action, changes the physiological factor such as electrolyte balance, water balance, temperature, also modified the drug effect. The metabolic disturbances are also important factor in the drug action. Example of it in case of iron deficiency, absorption of the iron from the GIT tract is maximum because of the metabolic disturbance. Then next one is accumulation. Accumulation of a drug in the body following its repeated administration is termed as the accumulation. This happens when the drug is excreted slowly. The dosage schedule of a such drug must be cautiously determined. While determining this kind of the drug, the physician should be taken care of such kind of drug which are give the accumulation effect or accumulation effect. Example of it, digitalin and imidine. Then next is the additive effect. Additive effect means the pharmacological effect of two or more drugs administered together is equal to the sum of their individual pharmacological effects. This phenomenon is called as the additive effects. In this additive effect, if we take the two or more drug, it gives the equal effect at that of their sum of individual pharmacological effect. That means if we take one drug, 1 plus 1, it gives the double. That is, it gives the addition 2. Example of it, ephedrine and aminophylline, when the total shows the additive effect in the treatment of the bronchial asthma. That means 2 drug taken, it gives their totally give their whole pharmacological effect. Then next is synergism. In the synergism, it is the phenomenon of the facilitation of the pharmacological response by the use of two drugs at the same time. The total effect is greater than the sum of their individual effect. Here is the difference between the additive effect and synergism. In synergism, there is a difference between the total effect we got from the two drugs. It may be more than that pharmacological effect. That is, here in synergism, 1 plus 1 is equal to not 2. Is here 1 plus 1 is equal to some 3. That means more effect than their pharmacological action. Example of its codeine and aspirin as analgesics, reserpine and hydrochlorothiazide in an antihypertensive drug. The next factor is antagonism. The opposite action of two drugs on the same physiological system is called as the antagonism. There are 4 types of the antagonism. Antagonism is divided into 4 types. First one is a chemical antagonism. The next one is a competitive or reversible antagonism. Then next is a non-competitive antagonism or irregular reversible antagonism. And fourth one is a physiological antagonism. Let's see one by one. In a chemical antagonism means, in case of the chemical antagonism, biological activity of drug is totally abolished or reduced by the chemical reaction between the two drugs. Example of its acid and alkali reaction with each other to neutralize the each other. That is, here is a chemical interaction between two drugs. Then competitive antagonism. Competitive antagonism, both drugs are compete for the same receptor, to attach for the same receptor. Example of its acetylcholine and atropine. They are compete for the each other at the same receptor site. Then non-competitive. Non-competitive is also known as the irreversible antagonism. In case of this case of antagonism, that effective complex with the agonist is not possible, or it may be reversible tolerance. In this case, antagonist inactivates the receptor by some mechanism. Then physiological antagonism. In this case, two drugs produces the opposite effect by acting through the different receptor. Example of its, the bronchoconstrictor produced by the histamine is released in anaphylactic shock and can be antagonized by the adrenaline. That means in this case, two drugs are, if we take in the two drugs, they give the opposite effect of each other. The next factor is the drug tolerance. Drug tolerance is divided into 3 parts. First one is true tolerance. Then next one is pseudo tolerance, and then third is the tachyphylaxis. Then again this true tolerance is divided into two parts. That is, first one is a natural tolerance and then acquired tolerance. Again this natural tolerance can be divided into two parts, that is the species tolerance and the racial tolerance. And this acquired tolerance is again divided into two parts, that is, first one is the tissue tolerance and then cross tolerance. Tissue tolerance, cross tolerance type of the acquired tolerance. Drug tolerance. On repeated administration of the some drugs, they may prove ineffective at the usual therapeutic dose. That's why progressive increase in a dose is required to produce the desired effect. This phenomenon is known as the or described as a drug tolerance. We have to require to increase the dose. The first type is true tolerance. It has been observed that the both oral and parenteral administration, it is further branched into the natural and acquired tolerance. Natural tolerance, it is by the birth, resulted from the birth. In a difference between the species to species, it has two parts: species tolerance and racial tolerance. And then the second part of true tolerance is acquired tolerance. On repeated administration of a certain drug, produce a tendency to tolerate a particular drug is known as acquired tolerance. This can be because of the repeated administration of the drug. Example of its barbiturates, opiates, xanthine therapy. Then acquired tolerance is further divided into two main types, that is tissue tolerance and cross tolerance. In a tissue tolerance, in that our tissues get tolerated certain kind of drug, and cross tolerance is for the, there are two drugs, if we take administered, they give tolerance because presence of each other. Then next factor is the second type of tolerance, pseudo tolerance. Pseudo tolerance has been observed only with the oral route of administration. Okay, when the small dose of poison is taken orally, then the tolerance to be is developed by the gastrointestinal tract. This is possible after the repeated administration of small quantities of the poison by the oral route, as the individual become immune to such a drug. This can be tolerance because of the oral route, not from the parenteral one, and this is because of the tolerance produced due to the developed by the GI tract. The next factor is the tachyphylaxis. Tachyphylaxis is also known as the acute tolerance. It has been observed that the certain drugs, when administered repeatedly at a short intervals of the time, shows reduced pharmacological responses. That means if we taken the drug at a short intervals, they reduce their pharmacological response and they produce a tolerance. It is known as a tachyphylaxis. That is example of its administration of the ephedrine. Example, repeated treatment of the asthma may be produce the diminishing response to the ephedrine. Then the next factor is drug dependence. The WHO describe a state of psychic or sometimes physical resulting from the interaction between the living and drug, showing the behavioral and other responses that always include the compulsion to take the drug in order to experience its psychic effect or to avoid the discomfort. In this case, in drug dependence, there may be the tolerance may be produced or may not be produced. But in a drug dependence, there is a condition of mind. We have to take on the drug, compulsion to take on the drug. There are two types of the drug dependence. First one is the physical dependence. In a physical dependence, we see sometimes the some withdrawal symptoms when we take the discontinuation of the drug, and this demand by our physical system. Then psychological dependence. In that psychological system, our the patient is mentally or patient get psychologically depend on certain kind of a drug, and not the physical one. These are the types of the drug dependence. Then summary, we have learned from this session, that is the different body factors or different factors which affect on the drug action are the body weight, age, sex, time of administration, route of administration, climate, genetic factor, emotional factor, presence of disease, metabolic disturbances, cumulation, additive effect, synergism, drug tolerance, antagonism, and drug dependence. So thank you very much. If you have any queries, then mail me. Thank you.